Welcome back to our 2 minutes focus on better posture. I'm Dr. Mark Giust with Giust Chiropractic Center, and this is Macey, my rehab assistant. Last week we talked a little bit about balance and posture, and this week we're going to demonstrate and focus a little bit more on core strengthening. Macey, you had mentioned last week that one of the things you see with our younger patients is a lack of core strength. And we have noticed that if we don't have good core strength, that can cause weakness in our activities of daily living and certainly cause a lot of fatigue in our back. The core muscles with many of these patients are hard to find, and have you noticed that when we're demonstrating this exercise that it's difficult for a lot of patients that don't have good core muscles to actually do this exercise. Is that correct?
Mm-hmm.
So one of the things we want to demonstrate today is how to even find your core muscles. So the exercise is called a pelvic tilt. And Macey, what are some of the first things that you do to help a patient engage those core muscles?
I usually start by having them step about 1 foot off the wall, push their pelvis against the wall and their shoulders back, and keeping that chin level and straight.
Okay. Now, I've noticed that Tracy has very good posture. Her shoulders are back well. Her head is against the wall. What do we do if patients cannot put their head against the wall?
They don't have to have their head up against the wall. It's not required, but you can put a roll behind your head or a towel, some type of pillow just to support it and keep it at that level.
Okay. So the important thing is to have the pelvis or your bottom against the wall and to have the shoulders against the wall with the head level, not looking up or looking down.
Right.
All right. And Tracy, you've noticed here, if I put my hand back here, we have a little bit of a hollow back here. Mm-hmm. And what we want to do to engage the core is to be able to tighten these front stomach muscles up, and as we do that, we should be able to flatten our back up and actually press our spine into the wall. So a good way to know if you're engaging your core correctly is to place your hand back there into that hollow. And then what we'll have you do is use your breathing as your guide. So we're going to take a breath in, and it's natural to lift the chest up when we do that, but we will see that our back will arch up. So when we take a breath in, we arch up, and when we exhale, we want to push the pelvis and the spine into the wall. So you should be able to feel your hand being pressed into the wall with your spine. All right, you're doing that perfectly. So it's going to be a breath in, we arch up, and we exhale, and we tilt that pelvis and press that spine into the wall. You will also notice, Tracy, that as we do this exercise, when we take a breath in, not only does the back arch, but our bottom will ride up the wall. And this is another good little tip that you know if you're doing this correctly, is when we arch in, the back rolls up, or the bottom rolls up the wall. When we exhale and press the spine, our bottom will roll down the wall. So these are two little good tips by putting your hand back to see if you're pressing your spine into the wall, and to roll that pelvis down or have it roll up. Macey, if we're doing this right and we feel those things, we know we're engaging the core to some degree. What are some of the things that you see patients do? Because if they have a weak core, sometimes they cannot do this simple exercise as I've demonstrated. What are some of the things that you see patients doing wrong?
I'll see them like squat instead of rolling their pelvis in.
Keeping the knees, not keeping the knees straight, okay?
Right, they'll bend them and kind of go up and down the wall like that. They'll look down and try to watch what they're doing, and then or they'll try to push their head back up against the wall and raise that chin, and that arches the back too much.
And we call that when someone has a weak muscle in any one area, patients will typically try to compensate with other muscles. We see that in all forms of exercise. So we want to start off with something very simple. If we can put the hand back there, if we can feel ourselves pressing into the wall, we can keep our knees straight, our shoulders against the wall, and our head straight. That's a good starting point to finding those core muscles. Next week, we would like to add on to this particular exercise, maybe give you a few other small tips that could help you engage and find these core muscles. We appreciate you watching this week, our 2 minutes to better posture. If you would like a demonstration sheet that we have written out, we do have those at the front desk, and we would love to have you stop by the office to pick one up and even get an office tour to see what our office looks like. So this is Dr. Giust with Macey. We invite you to come back next week where we will continue to work on core postures and strong postural muscles. Thank you again for watching.